All new tonight, a record number of Americans are stressed out these days. A survey from the American Psychological Association found nearly 8 in 10 adults say the pandemic is a significant source of anxiety. Channel 3's Caitlin Nuclo spoke with an expert on how to know if you need help.
At Hartford Healthcare's Institute of Living, the demand for help is high.
We've been much busier and seen not only new folks that hadn't presented with mental illness or anxiety or depression problems before, but also the current population that we're treating, increased numbers of people that have increased needs related to their symptoms worsening.
Nurse practitioner Art Guerra says the pandemic is taking a major toll on mental health.
Maybe if this was a time-limited phenomenon, people could shrug things off and their resilience would kick in. They would feel better. But I'm worried, and I think many professionals are worried, that COVID is going to be with us for a while. And this ongoing stress that happened earlier this year and is now continuing might be a lot if people are experiencing mood changes or anxiety at this time.
Symptoms like irritability, struggling to eat or sleep, lacking interest in things that you used to enjoy, and low energy are just some of the signs that you may need to talk to a professional.
The issue around folks that might have anxiety or depression but have never experienced that before, and they're just not sure what's going on, and they might be in disbelief.
How can you tell if the difference between just having an anxious feeling and thought and knowing that it's something bigger?
You might think of it in the following way, that I've certainly had anxious thoughts over COVID in the last 6 months, but if they persist and I can't shake the thought and it interferes with my ability to concentrate at work, it interferes with my ability to get to sleep or stay asleep. It just interferes with my day-to-day activities and my day-to-day thought process.
Being able to recognize that change in yourself is the first step toward being able to get help. He says you should also be looking for those signs in your loved ones.
When you hear family members or friends saying, "Are you okay? Is something wrong?" If you're hearing that in several different spheres of your life, you might have to reflect yourself, do I need to get some support or help?
Caitlin Nuclo, Channel 3 Eyewitness News.
Caitlin, thank you very much. Obviously a very serious issue right now. If you do think you need help, don't wait to reach out. Talking with your primary care physician can be a good first step. We'll talk more about what you can do to help yourself and your loved ones who may be struggling in the next half hour.